Do you feel like nursing is still the most trusted profession in the world? Simple Google search will tell us that nursing has been ranked as the most trusted profession in the US for over 2 decades, due to the unparalleled combination of compassion, expertise, and consistent patient advocacy during some of the most vulnerable times. I am Monica. I'm a medical harm recovery and prevention coach. I am also a neurodynamic breathwork facilitator and very passionate about whole person health, physical, mental, emotional, spiritual. I've been a nurse for almost 20 years, but I certainly haven't imagined that I would see a time when patients are starting to wonder, can I trust my nurse not to intentionally harm me, the person caring for me, when I'm probably the most vulnerable? And not simply because nurses are human and humans make mistakes and that anyone can have a bad day, but because the nurse may want to intentionally inflict harm because of their own beliefs or my beliefs. And sometimes they even want to encourage other healthcare workers to join them in that crusade. We'll talk about some of these examples in a little bit, but I just want to say that we nurses are taught from day one in nursing school that our personal beliefs do not dictate who deserves care and compassion. The ANA, American Nurses Association Code of Ethics, clearly says the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. And that the nurse's primary commitment is to the patient, not to a political party, ideology, religion, personal convictions, or causes, but to the patient. We are taught to take care of everyone, to be aware of our own biases and put them aside. Throughout our careers, we all have taken care of a wide variety of patients that we might not agree with, people with religious and political beliefs not reflective of our own. We take care of patients who may have harmed others, who are acting out and call us names. We've taken care of mothers who maybe took drugs during their pregnancy, people who may have caused accidents because of DUIs, and so on. But by becoming nurses, we promise to take care of everyone with the same professionalism, the same ethical standards. And when we find ourselves judging them or even despising them, that becomes our own internal work. We do not act out in dismay. Through our care of a wide variety of people, and if paying close attention, something powerful can happen to us. We learn about other cultures and customs. We may realize we were wrong sometimes. We notice biases in ourselves we didn't realize we had. We're sometimes forced to confront our own assumptions, beliefs, and judgments about other people, and that can help us grow, even though it might be uncomfortable. But it is necessary because providing care when done ethically should make us more compassionate and not less. It can soften our rigid thinking, it can expand our perspective, it can even change how we see ourselves. Let me give you an example. Imagine that you're in an accident or your loved one's in an accident. Something happened to them and they need help. And the first person that's able to stop and help them is someone that you vehemently disagree with politically. You don't agree about the opinions they have about politics, current events, any sort of issue, you name it. Would you rather they didn't stop and help your loved one? Would you rather they let them be because they saw they had a hat or a shirt that may mean something politically? Or would you like for them to stop and help that person anyway? Just think about those things. So this doesn't mean nurses and healthcare professionals don't have personal beliefs and opinions. Of course we do. But it does mean we have a moral and ethical responsibility to understand that what we say and do publicly will be seen through the lens of our profession. We can speak about issues, we can advocate, we can protest. Those things are not the problem at all. But weaponizing medical identity or threatening harm definitely is. We all have dark thoughts, but when some of our dark thoughts become actions, when someone starts imagining what would happen if they slipped a little extra medicine into someone's veins, but then actually fills up the syringe, That is a problem. The trust hasn't eroded overnight or for one single reason. I think it's been cracking for the last few years, and I do believe that COVID played a big role. For example, coercion through vaccine mandates under the threat of losing one's jobs, or censorship through punishing anyone speaking against perceived authority, punishing, canceling. And most recently, nurses wishing harm on people. One of the most prominent examples is a Virginia CRNA, certified registered nurse anesthetist, Melinda Cook, who publicly suggested using syringes and drugs to harm people she doesn't agree with.
I thought of something good. I think it's something weird spot. Sabotage tactic, or at least scare tactic. All the medical providers, grab some syringes with needles on the end. Have them full of saline or succinylcholine, whatever.
She recommends her healthcare workers do the same and fill their syringes with drugs like succinylcholine, a paralytic used in anesthesia. She also recommended putting poison ivy into syringes, going out on dates with government employees she doesn't agree with, and spiking their drinks and food to make them sick so they can't go to work the next day. And Florida nurse Eric Martindale, who stated he would refuse anesthesia to any patients based on their political beliefs and that it's his ethical right. Now, I'm not sure that he's a CRNA because I couldn't find that license anywhere. I know he's a nurse and he's since relinquished his nursing license, but it does raise serious questions on how he's representing his scope of practice. Another nurse who seems to work in labor and delivery wished our White House press secretary experienced birth trauma and damage to her body. And new examples seems to be popping up left and right every week. Every one of these public messages damages the public trust of our profession and makes people wonder how safe hospitals and clinics really are these days. But I can't help but wonder if these nurses ever stop and think what would happen if they or their family were a patient in the hands of someone with opposing political beliefs but had the same approach. So, of course, most, if not all, these nurses have already been fired from their jobs. They may be losing their licenses, but unfortunately, it does not mean that at some point they won't get their license reinstated and work at other hospitals and other states, just like Charles Cullen did. Now, I don't know if you've heard about Charles Cullen, but he was a nurse who began a killing spree just 2 years into getting his license in the late 1980s. And he went completely undetected for 16 years until 2003 before he was finally arrested and brought to justice, killing dozens of patients. Now, unfortunately, additionally, all of this doesn't mean that there aren't other nurses who feel the same way as Melinda Cook and Eric Martindale, but they just don't publicly announce their plans to use medicine as a weapon. The moment a syringe becomes a weapon in someone's imagination, healthcare stops being healthcare. And when activism enters the treatment room, medicine loses its moral center and patients become collateral damage. So if watching these stories makes you feel anxious about nurses and doctors and healthcare workers and hospitals, procedures in general, I would say that's a pretty normal response. You're just reacting to real information and it's only natural to wonder. So let's be honest, these cases are fringe, of course, and they don't represent the vast majority of healthcare workers, but fringe does not mean non-existent. And pretending people like this don't exist to avoid feeling fear does not protect anyone. What can you do, you might ask, if you have to go to a hospital? So here are some of my recommendations and opinions. Take it for what it is. Know that you have options, that you have rights, you can say no, you can find another provider. Work with providers, doctors and nurses who you've known and trusted over time. Seek recommendations from those sources and do your own research before you visit a new clinic, sign up with a new doctor, and so on. Most importantly, like I always say, use your gut, listen to your intuition, because most of the time when you see a new doctor or a nurse, you get a feeling from their approach to care, their mannerisms, and whether they engage in current topics with patients because they just cannot help themselves and they need to talk about it and they need to know how you feel. If you feel uncomfortable with anyone taking care of you, ask for a different provider. Simple as that. If you hear political conversations in patient care areas, take note, and if necessary, ask to speak to the manager of the unit, voice your concern. Because politics does not belong in healthcare settings. It just doesn't. If your procedure is elective and the environment feels wrong, you can walk away and reschedule. Now, if your nurse is your neighbor and you guys like talking about politics outside of the healthcare environment, no problem. That's totally up to you. But in the healthcare settings, I recommend keeping interactions with people calm, conversations neutral, focus on your healthcare needs, and small talk to help with any anxiety. Don't engage in topics that can spark controversy. Patient care areas should be free from those contentious conversations and any battles of the mind. That's reserved for just that, patient care. So my recommendation is, if a nurse or a healthcare worker brings up a political or ideological topic, just politely decline to discuss them and turn attention to small talk or healthcare or anything else. Don't ask about their beliefs. Don't comment about current events, no matter how tempting it might be for you. Just stay out of that. Just stay away from it. Now, let me very clearly say and highlight the fact that most nurses and healthcare workers are good, ethical, and compassionate people who are in this profession as genuine caretakers. Even when the few cases make it seem like that's what our system is becoming, it's just simply not true. Most of us enter this profession to reduce suffering, not to create it or decide who deserves it. And most of us are very well aware of not bringing in politics and religion into the workplace. But what is the answer, some might ask? Do we just mandate everyone have the same beliefs and opinions? Do we create 2 sets of healthcare systems, or 5 or 10 or 20? Do we stop providing care based on our changing thoughts and ever-evolving beliefs? Of course not. We always start with ourselves. We examine our own beliefs and biases. We practice radical self-honesty and self-reflection. And we can seek counsel from trusted guides and leaders, whatever it may be for anyone, personally. And lastly, nursing became the most trusted profession because of ethics, humility, compassion, empathy, and service. We don't keep that trust by pretending that problems don't exist, but we keep it by confronting them, protecting patients, and refusing to let medicine become a battlefield. And that's up to each one of us. So one by one, we show our commitment to the oath we took and to the ethical guidelines we were taught, checking our biases at the door while being aware of them, not judging ourselves for them, but not ever letting them guide our care for those we promise to keep safe. And that's it for today. Feel free to subscribe, comment, and I will see you next time.